Hi everyone, my name is Jameson Self. Today for my healthcare policy video project, I'll be talking to you all about patient confidentiality regarding substance abuse treatment. The first thing that comes to mind in most people's heads when you think of patient confidentiality is HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. This policy, by its definition, was enacted in 1996 to protect patient health information and keep it private. Um, According to researchers Tarek and Halkart, HIPAA's three targeted areas of patient care are portability of insurance, detection and enforcement of fraud and accountability, and to simplify administrative procedures in healthcare and other professions. Um, to, in, to, relate, to relate that, they want to protect patient information and they want to make it easier to share information within a healthcare setting regarding patients and beyond a healthcare setting because HIPAA not only extends into the healthcare setting but beyond the healthcare setting because you cannot share patient information outside of a hospital or out in your home or anywhere for that matter other than with the patient and with the patient care team. It's important to note right now that HIPAA protects patient information in almost all circumstances except gunshot wounds, stab wounds, injuries during a crime, child elderly abuse, and infectious, communicable, or reportable diseases. Like right now with the pandemic, um, HIPAA would not protect patient information. That information would have to be shared with individuals and organizations such as DHEC, the DOD, other government agencies that need to share information, and they can't. And HIPAA would not protect that. Now, in regards to substance abuse treatment, that is protected under a different federal regulation. It's Title 42 of the Code of Federal Regulations, Part 2. This is a federal regulation that controls how and when information on people that are undergoing treatment for alcohol and drug use disorders can be shared. Like HIPAA, this are some instances that where information can be shared under medical emergencies and or research and under a court order or when required to do so in accordance with child abuse or elder abuse or during the crimes of a criminal activity. This policy, however, unlike HIPAA, is very, very vague. Researchers and clinicians they do not like Title 42 of the Code of Federal Regulations because it is vague. It doesn't outlaws what can be done under it, what should be done under, and who can and when can they share information. Unlike HIPAA, where it says and it's outlined pretty specifically of who and when can information be shared. One clinician and researcher report that they had their treat people undergoing treatment sign consent forms right away because they were afraid that their patient information would be shared and they would be held accountable. And patients were just refusing to do so. You have to understand that when regarding substance abuse treatment, patients aren't going to share that information. They don't want that information shared out because substance abuse is a topic that's not really shared among people and not shared in a positive light. People undergoing substance abuse can and sometimes a lot of times are discriminated against because they just viewed negatively. People are stigmatized them negatively. A lot of times, if people find out that people are getting treatment for substance abuse, they won't allow them to have they don't have the equal rights to jobs, housing, government assistance, and they're just looked at as criminals, which in reality they should be looked at as people, and they should be actually cared for more because they are trying to receive treatment. Um, Hopefully this has been a little bit of eye opening for this information that I've shared with you today. And people with that Title 42 of the Federal Code of Regulations, they would like to see it change and it be made more like HIPAA, but legislation has been yet to do that so far. Thank you. Once again, my name is Jameson Self, and I hope you enjoyed this video.